Hello, today we are going to talk about robotic thyroidectomy and robotic parathyroidectomy. I'm Dr. Vineet Kaul, head and neck surgeon at Fortis Hospital, Manesar, India, and here to tell you about robotic thyroidectomy and parathyroidectomy and clear all your doubts. So, robotic thyroidectomy or parathyroidectomy, it means using the robot, the surgical robot, to remove part or whole of the thyroid gland and the parathyroid gland. Function of the thyroid gland is hormone production, thyroxine production in your body, and sometimes that can get deranged, or some tumors may form in your thyroid gland, and that may need to be removed surgically. Parathyroid surgery or parathyroidectomy is done when the one or more of the parathyroid glands they enlarge in size and start producing more parathyroid hormone. This leads to calcium imbalance in your body and can be cured by removing the affected parathyroid glands. So, what is the advantage of using a robot over conventional techniques? Conventional technique involve giving a cut in the neck and opening all the structures which we encounter thereof, like the muscles, the vessels, the nerves, separating them and then reaching the thyroid gland and removing it. Later on, all this was closed up. That means it was stitched, and we had to put a large drain in your neck because a lot of dissection or removal of tissue from the body has been done. Now, the advantage of robot is that it gives very minimal scar and very minimal disturbance to the important tissues of the body. So we don't have to give a cut on the anterior aspect of the neck. We can enter from the axilla, which is the armpit, or we can enter from inside the lip. And we can go underneath the skin, and the camera and the robotic instrument, because it is very advanced, can reach up to the area of the thyroid gland, and the surgeon that I can operate there. So, what is the advantage in layman's language? The advantage is that the structures that need to be preserved in thyroid gland, like laryngeal nerve, recurrent laryngeal nerve, which is nerve of the voice, is very easily visualized during a robotic thyroidectomy. So it is very safe to do. It is much more safer to do a robotic thyroidectomy than an open thyroidectomy in particular cases. Also, the identification of parathyroid glands, especially with the high-end surgical robot that we have, is easier because it has a special camera, a fluorescence imaging system built within it. It's inbuilt in that, and that helps to visualize the parathyroid gland separately during the surgery intraoperatively. So we can see and we can preserve the parathyroid gland during thyroid surgery. That leads to a lower incidence of hypocalcemia, which means low calcium post-thyroid surgery. Complications I'm talking about, nerve damage and hypocalcemia, are very common. They are around 10 to 15% in using the conventional or the open techniques, while very low, like less than 1% with robotic thyroidectomy. Also, coming to robotic parathyroidectomy, the parathyroid gland can be removed with a similar approach and without giving any cut in the neck. And yes, as I talked about the identification, easy identification of parathyroid gland, no other surrounding structures are damaged during the surgery. Now, one of the biggest advantage of using a robotic thyroidectomy is yes, it's definitely a cosmetic one. Definitely, most of the time we are not concerned with just the cosmesis. We want the functional outcome to be there. But those who desire a good cosmesis, that they don't want a scar on their neck, a cut on their neck, because neck is an exposed area, can also opt for robotic thyroidectomy for cosmetic reasons. So it is a very good surgery, a very good technique, and I would recommend anyone who is going for a thyroidectomy to opt for a robotic thyroidectomy if they can. Thank you.